can see me. I am very glad and excited to be here on the international workshop on integrated oncology and homeopathic research. Today, I will cover the topic of integrative oncology for future homeopathic physician, skills, ethics, and career pathway. If you have any question, you can ask me after the presentation. I will try to answer them. Today, I will cover the topic of definition. But what do you mean by integrative oncology, homeopathic remedies in various carcinomas, carcinogen-induced apoptosis, palliative approach, homeopathic approach, role of future homeopathic physicians, skills, red flag symptoms, communication, career pathway, and future. Uh, Now, I will first describe what is integrative oncology. Integrative oncology means coordination of conventional treatment and supportive treatment system. It means it is a combination of conventional system. Conventional system means we can say it's allopathic or orthodox treatment, and supportive treatment means I have described here that nutritional counseling, exercise program, psychological support, uh, mindfulness, pain management, palliative care, acupressure, stress reduction therapies. We use this method as supportive approach in integrative oncology. Uh, in integrative oncology, we use surgery, chemotherapy, radiotherapy, immunotherapy, targeted therapy, hormonal therapy, as well as we use supportive therapy with the conventional treatment. Our main goal, I have described here, you can see our main goal is to reduce the symptom burden of the patient. We want to reduce the symptom, improve quality of life, support emotional health, enhance functional well-being, help patient cope with treatment. Uh, we can ask why patient ask for complementary care. Complementary care, we have described our goal that complementary care can reduce symptom burden. Cancer patient suffers from the sufferings of cancer, as well as the treatment after treatment, some side effects or the medicinal some medicinal symptoms. It can reduce the complementary care, such as fatigue, anxiety, sleep disturbance, pain, nausea, fear of recurrence, depression, loss of control. Here I have given some example of uh, some homeopathic medicine, which can reduce the sufferings of cancer patient. You can see there is calcarea floor, lapis alba, silicea, hecla lava, baryta iode, plumbum iode, bromide, phosphorus, iodium, cicuta verosa, calisol, cedron. Every medicine can reduce the sufferings of cancer, such as silicea can reduce cancer pain. Cedron can reduce the lancinating pain of cancer. Uh, there are other medicine which can also reduce the pain of cancer or suffering or burning, or uh, which can that can reduce the other symptoms such as sleeplessness, Nax bhumika, or cheridonium. This can reduce the sleeplessness and nausea. There are so many medicine which can be used as the complementary medicine. Now I have given some example uh, in the carcinogen-induced apoptosis. Carcinogen-induced apoptosis is a new term for our some of our homeopathic physician or student. Carcinogen-induced apoptosis means we use a carcinogenic agent which can kill cancer cells. It's a very good. It's a very interesting thing in which can which is similar to our homeopathic approach. So I have given here an example: a male with undifferentiated lung cancer a woman with leiomyosarcoma. Leiomyosarcoma means smooth cell carcinoma, and is a child with astrocytoma. Astrocytoma means supporting cell carcinoma. It causes carcinoma of brain or spinal cord. Were treated with a new homeopathic approach of carcinogen-induced apoptosis. Here the doses was ultra low dose. Ultra low dose carcinogens were administered for 2 to 3 months and showed complete remission of cancer and increased life extension. Here I have given another approach, palliative approach of homeopathy in cancer. Homeopathy can be used as supportive or palliative treatment to develop general health and to relieve the pain and suffering resulting from orthodox treatment. Orthodox treatment means allopathy or conventional treatment. Cases of metastasis, adenocarcinoma of the rectum, terminal squamous cell carcinoma of the cheek, and carcinoma of the larynx received homeopathic medicine prescribed on constitutional grounds, which relieved patient symptoms markedly. Here I have given an example of a ointment, a study using tramwell as in cancer patients with chemotherapy-induced stomatitis. Stomatitis which caused after chemotherapy, after using the ointment, showed significant reduction in duration and severity of stomatitis compared to the control group in a randomized control trial. Who doesn't understand randomized control trial? I will describe here. Randomized control trial means we divided the patient in two groups. One is case group, one is control group. Case group receives the treatment and control group doesn't receive the treatment. When tramwell is used in the case group, in which the reduction or severity of stomatitis is noticed, and the control group, the reduction is
তো লিড নিয়ে তো এখানে তো বলছি লিড নিয়ে অ্যাসেস দেখাইতে, তো ইন্টারেস্ট যেহেতু লিড নিয়েছে না, তো ইন্টারভিউ করে যাই জিজ্ঞেস করো যে লিড নিয়ে অবশ্যই অ্যাসেস দিচ্ছে, এই অ্যাসেসটা দেওয়ার পর কি মানে তারা কি হচ্ছে ওই ভিত্তিটাই
হ্যালো
মানে ওই হোমিও ভিত্তির
হ্যালো
কথা কি বলা
আপনার
হয়েছিল কিনা, ঠিক আছে? তাহলে মানে কনফার্ম হতে হবে হ্যাঁ আমি তো সিসিটা হোমিও দিচ্ছি, তারপর লাইক ওইখান থেকে এখন যারা লিড নাম নিবে আর কি, যারা অ্যাকশন নাম নিবে, ঠিক আছে? এই জিনিসটা
পীযুষ
থেকে কনফার্ম হবে।
ইয়াসিনকে মিট করে দে তো। আচ্ছা ইয়াসিন আপনার হচ্ছে মাইক্রোফোনটা অফ রাখেন।
Now I will describe the role of future homeopathy. Oh, I have skipped one part. Homeopathic approach for menopausal syndrome. It is also an example of homeopathic treatment system. Here we can see a study evaluated homeopathic medicines or menopausal symptoms. Menopause means cessation of menstruation. If the menstruation is absent from 12 months, so we can say the menopause has occurred. A study elevated homeopathic medicines on menopausal symptoms. Here we can see a study of homeopathic medicine on menopausal symptoms, mainly hot flashes in breast cancer. Breast cancer patient who receives treatment and cured but is suffering from hot flashes. Patients are randomized into group receiving individualized single medicine, including calcarea, calica, lacetic, sepia, or sulfur, or combination medicine. Both homeopathic groups showed significant improvement in quality of life score compared to the placebo. Here we see the same method. One is case group, one is control group. case group received the treatment and control group received the placebo, and we can see the result is different. The group which received the treatment, calciracarb, calicarb, lachesis, sepia, sulfur, are uh, are relieved from the symptoms, and which group doesn't receive the medicine or receive the placebo are less are suffering from the hot flash. Role of future homeopathic physician. Now I'll describe the role of our or role of future homeopathic physician. Our possible role in which we can work. Possible roles: careful listening and patient-centered consultation, emotional reassurance and empathy, lifestyle guidance, management support, symptom documentation, referral to appropriate specialist, helping patient navigate support care resources. Ethics. The most important principle: never promise cure for cancer, discourage surgery, chemo or radiotherapy, delay biopsy or diagnosis. Many physicians try to delay the biopsy or diagnosis, uh, which never should be done. Exploit fear for financial gain, give false hope, mislead vulnerable patient. Always tell the truth, respect informed consent, encourage standard medical care, refer promptly when necessary, work elaborately. Now, the essential skill for homeopathic physician. The skills we need. Communication skill. Communication skill is very important for a homeopathic physician. Listen carefully. Showing empathy, explain limits honestly. Building trust without deception. Clinical awareness. Recognize common cancer symptoms and treatment side effect. Red flag recognition. Know when urgent referral is required. Research literacy. Research literacy, we understand the patient evidence level, case report, observational study, randomized control trial, and systematic review. Interdisciplinary professionalism. It's very important. Respect oncologist, surgeon, nurse, and psychologist, dietitian, and palliative care tips. Red flag symptoms which we need to refer immediately if we notice any of these symptoms in a patient. Rapid unexplained weight loss, persistent lump or swelling, uncontrolled pain, bleeding, difficulty swallowing, severe vomiting, jaundice, new neurological symptoms, breathlessness, fever during chemotherapy. How to communicate with cancer patient? Here I have given some example. It's only example. We have to communicate with cancer patient with honesty and try to comfort him and inform him about the treatment method and what are the outcome maybe. Here I have given some example that please continue oncology treatment. This may be supportive, not curative. Discuss all therapies with your oncologist. Your safety comes first, and avoid saying stop chemo. This will cure cancer. Natural means guaranteed safe. Natural means guaranteed safe. It is a common term we homeopathy use, which should be avoided. Cancer pathways for future homeopathic physician. Career pathways for future homeopathic physician. Future pathways are clinical practice, supportive symptom care with ethical referral system. Integrative clinics, we can work alongside with multidisciplinary teams. Research, we can research about the study quality of life, consultation modes, survivorship support, public health education. We can promote early detection, screening, tobacco cessation, healthy lifestyle. Screening means some test which can detect the cancer early. Teaching, train future students in ethics and evidence-based practice. The future of integrated oncology. Modern cancer care implicitly values whole person treatment. And our homeopathy, we know that it is holistic treatment that we can support the survivorship care, mental health support, shared decision making, safe complementary strategies. This creates opportunity for practitioners who are humble, ethical, evidence aware, and collaborative. Here I have given a final message for all of you. We know the best practice who combines humanity, honesty, scientific awareness, ethical discipline, respect for patient safety. They are the they are I will try to answer your question. If anyone